Yes, hello. And now it looks like I'm here. And I am live. I probably would have said something sooner if not for me trying to quickly eat something so that I don't feel the need to do that afterwards. But are unable to act on it. And which should have been easier by virtue of me having a dentist visit just a few hours ago, involving a shot of anesthetic, which was surprisingly potent, to the point that it pretty much made my eye numb. Had never known the effects of an anesthetic for the gums to extend to the nose or even the eye, but apparently it happens. It took me 22 years to learn this. And I am getting surprised as to how long this loop goes on for. It's like 5 minutes, even though I'm pretty sure the actual loop is shorter than that. How well. I'm pretty sure the loop's about to end anyway, so I should probably turn the volume up to the midpoint so that I can get a more realistic idea of how that sounds versus the rest. There we go. But yeah, I believe that's been looping enough times, so it's time for me to fire this up once again and see if I can get through some of it. And apparently the last sulfur capture thing I tried to capture was a kind of stealth stream of Sims 3 that I made a few days ago, where I kind of tinkered around with Black Lodge characters for a while. Also, I guess I need to change the controllers again. Didn't change them after Baroque. I hate the actual track end. Alright. This is the one I want. Alright. So let me see what I was doing. I'm pretty sure that, like before, the thing that had to be completed in this time unit as before moving on to the next one is a diagnostic stage. So let's go ahead and get started with that. In this story, which is pretty ordinary so far, besides the occasional appearance of that weird shadow that makes bad stuff appear.
Hey, Hank! What? So you're the one who takes care of the flowers? Well, I'll be.
They enjoy flowers. You give them love, and they blossom.
So different from humans. So, what'd you need me for?
Well, apparently nothing.
Could you take a look? This condition is a strange one.
Except that.
So, what's with all the fuss today?
Well, you haven't heard? Someone's doing an OLCVR today.
You're kidding, right? No one does that procedure anymore.
I'll be assisting. A specialist's coming in for it. It's one of your patients, you know.
Apparently...
Don't tell me.
Apparently the transition of time
Hey, out of the way! Let me through!
is a bit disfaced.
It's all right, man. I thought you'd come.
So, it is you. An OLCVR? What are you thinking?
You told me yourself that you're the doctor, right?
Yeah, may have said something along those lines. So?
Well, you're the doctor, and I'm the politician. Yeah, well, it's my duty to lead this country, even if my life's at risk.
But do you have any idea what kind of operation this is? It's outdated and it won't cure you. It's just a stall.
Ha! You afraid? You were so strong before, preaching at me. But son, you don't get to my age being as timid as you are. One thing I've learned over the years, never give up.
Damn. That's one determined old fool.
Well then, Doctor, let's begin today's diagnosis.
So apparently the order of things was like orthopedics in this one, and then the surgery one, which is the actual procedure that apparently that guy was getting. Which, if I am to take this cutscene at its word, means that it's indeed, I guess, a substitute for the heart replacement that the guy apparently needs. Where they just drain weird pockets of blood from it, but well, we get a diagnostic to work on, so.
The patient, Shelley Brooks, claims to have a fever.
Patient with a fever. But she has previous treatment for chronic renal failure.
Dr. Cunningham, are you listening?
Yeah.
Your concentration is low. You may overlook something critical.
Huh? What are you talking about? It's not gonna happen.
Does Assistant Secretary Tillman's operation weigh heavily on your mind?
Shut up. It's not it.
I'm sorry, Doctor, but if you are troubled, I am equipped to listen.
They even gave you a consultation function, huh?
No,
Well,
but I can supply template responses to match your mood.
Yeah, that's just pity comfort. Come on, let's start the diagnosis.
Understood, Doctor. I am now opening the patient's chart.
it's alright, I'm sure this will be a perfectly ordinary fever, as per the norm, you know.
Hello, I'm glad that someone could see me.
Not a problem. Now, to begin with,
I'm sorry, Doctor, but I have to attend an important business deal soon. Is it possible to keep this as quick as you can, please?
well, I wasn't planning on wasting time. Roni, are you ready?
Yes, Doctor.
All right, let's start the diagnosis.
Alright, that's an interesting pattern on those stockings. I'm sure it won't come up after all, or at all after this.
Can you prescribe me something so I can get back to work?
So let's see. What are you? What is your deal? What do you need?
You can? Oh dear, this isn't good. I've got a meeting soon.
What ails you?
I've had a fever for a while and it won't go away.
Oh, that's one way to say it straight at least.
A continuous fever, huh? Perhaps... Excuse me, but are you married?
Doctor, is that relevant to my illness?
Well, there's no direct relevance, but a woman's body temperature increases during pregnancy. We see a lot of women who think it's a fever.
Oh! Well,
Well.
thank you for thinking about that. Nope, you don't have to worry about that. I'm totally concentrating on my job now.
I see. Then let's make a note of this, Roni.
Understood, Doctor. New symptom observed. Fever.
I've also lost some weight, but I think it's just because of the fever.
I also noticed that black rose on her label.
Whether this is a symptom or not depends on how much you lost. So, what was your original weight, and what is it now?
So I guess you would have to keep track of the numbers to actually realize this is a thing, but
I don't really want to mention how much.
Okay, you don't have to be specific. Ballpark it.
Well, it seems like a lot. Like it's more than should be natural.
I see. I appreciate your cooperation. Roni, jot that down.
Understood, Doctor. New symptom observed. Weight loss.
Besides that,
oh boy.
I've been having night sweats, but that might be the fever too.
Well, let's make note of that, so.
Dysautonomia is the first thing to come to mind, but... You've been busy with work, right? Does it stress you out?
Stress? That's a good one, Doctor. I love my job.
Stress is a myth, right?
You're a strange one. If I had my pick, I'd be sitting on my couch all day.
That is not relevant, Doctor. New symptom observed. Night sweats.
Sheesh. Enough already.
Oh boy.
Starting to sound like my wife.
I can't think
Well,
of
is there
anything
anything
other
else? I guess there isn't.
than that. Oh, I wasn't trying to hide this or anything.
Unless it suddenly comes up like
But
this.
I had an operation 2 months ago. It wasn't at this hospital. I had some kidney trouble and received a transplant.
Is that abnormal? I don't really know.
There are some odd bruises around the scar from the operation.
Well, that's not necessarily what this probably is. Odd bruises around the transplant scar.
Around the operation scar? That worries me a little. Could you tell me in detail where they are and what they look like?
Oh, yes, of course. The scar from the transplant healed cleanly, so there isn't much of it left. But there are these black bruise-like things around where it was.
I'll need to look at it in detail. Would you mind showing me later?
Yes, if you need to see it for the examination, I understand. It's strange. I made sure to take the medication they gave me, too. But that's it, really. See? It's just a cold, right?
A cold and...
Abnormalities around the operation scar, huh? Well, let's see them.
and scar abnormalities from a kidney transplant. Well, can we see them? 12? Is that really what you would call a bruise, though?
It's true there are dark red pigment spots around the operation scar. Did these exist before the kidney transplant?
No, I'm sure of it. I'd have noticed if those were there before.
Did you show these to your doctor? What did he say about them?
This is the first time I've seen a doctor since the operation. I've been so busy at work that I couldn't keep any appointments.
I see. Then this needs to be examined. Roni, I'll need a scintigraphy and a biopsy done.
Understood, Doctor. Since biopsies are done in the pathology department, it will take some time. Is this acceptable?
If it's not in our department, I can't tell them to do it right away. Just let me know when the results come back, Roni.
Understood, Doctor. New symptom observed. Pigment spots. Also, the scintigraphy is ready.
Well, already we got one visual exam, and 2 counting this one. As far as observing her strange fixation with roses in pretty much every part of her clothing, by the looks of it. Well, we need to auscultate as well. I'd say it sounds normal. What about the heart? Which is apparently in the middle and not on left. Normal, what about the stomach? Yeah, apparently that's all normal. I guess it's time to go and look at the images. I can't even remember if there's like ever
The scintigraphy exam already.
an abnormality that you can actually find in the stomach sounds just out of off the top of my head. Also, I should probably confirm something before I continue. Or alright.
I know. I came here to check them.
Well, let's look at what images we have right now, or what one of them we have. Thallium uptake in the body. Well, I see a slight abnormality on one place, but isn't really anything else, is there?
So, the uptake of thallium matches the pigment spots on the skin.
Apparently that place
Good
is
chance
kind of
the pigment spots are
suspicious.
tumors. We should review our diagnosis candidates.
Understood, Doctor. New symptom observed. Abnormal uptake into pigment spots.
guess that's all we're gonna find out for now, though. We got abnormalities in the kidney area, and these apparently fever symptoms, as well as those red pigment spots. So, what could that lead to? Red pigment spots appear. What is this one again? Inflammations. Lack of appetite, fever, and joint pain. Oh, we got one of those. What about erythema? A skin disease. Symmetrical pigment spots on both sides of the body. I don't think we have that though. Fever and no joint pain though. No idea about the antibodies. We don't have a blood analysis yet. Malignant melanoma. We really think that this has to do with the skin just because of the pigment spots. No oddly shaped tumors though. Influenza. Chills, fever, headache, lethargy, muscle pain, weight loss, and night sweats. Well, we got 3 of those. But no pigment spots. We don't even know if those two are like related to the same. No, well, whatever. There's also a Kaposi sarcoma caused by herpes virus 8. Fever, weight loss, and night sweats. Looks like we're hitting the lottery here. Pigment spots and scintigraphy will find abnormal uptake in those areas. You also need to observe for antibody reaction, which we don't have yet. An extreme decrease in the immune system has occurred. Well, apparently if this is the case, then it's bad.
Kaposi sarcoma? All our symptoms apply to it, but...
Doctor, are you concerned about something?
There's no way Kaposi sarcoma occurs unless there was an extreme decrease in the immune system.
Yeah, that's what I was talking about just a second ago.
If we don't solve that portion, it's impossible to make a diagnosis. I feel like it's right there in front of me. Roni, do you remember anything that might help?
Negative, Doctor. I record only pertinent facts in my memory. Would you like to change these settings so that I record every detail of the diagnosis?
No, let's not. I feel like I'd be cutting off all my escape routes if I did that. Oh well. It's time to listen to what the patient has to say again.
I guess we gotta listen to them again, even though the only symptom we need to fill out that candidate is antibodies.
Sorry to keep you waiting when you're so busy. How are you feeling?
Nothing much has changed in particular. Is this gonna take long?
Don't get so hasty. It's going to take a little more time until you're diagnosed.
I see. I've got a meeting soon, though.
Well, guess we need to listen again.
I think it's just a cold.
We've already listened to this though.
I've had a fever for a while. I've also lost some weight. Besides that, I've been having night sweat. I can't think of anything. Oh, but I had an operation too. I had some kidney trouble. There's some odd bruises around the scar. It's strange.
Well, there's a
I
kidney
made
trouble.
sure to take the medication they gave me too. But that's it, really. See? It's just a cold, right?
So, the only things that could be left to remark on. Severely inhibited immune system, yes. We need to look for something to indicate that, presumably from the previous issue with the transplant.
There's some odd. It's strange.
I guess the medication?
Oh yeah, the medication prescribed after the kidney transplant. Hey, I'm sorry, but can I confirm something? You were given immunosuppressive drugs, right?
Yes. Isn't that something normal to take after an organ transplant?
Yeah, that's right. But that's something we need to know in making a diagnosis. Now, everything depends on the results of your biopsy.
Alright. Guess we got that last piece of information now.
The biopsy results have come back from the pathology
And
department.
as if on cue.
Finally. How are they?
The antibody reaction was positive, but they failed to specify the virus causing the disease.
Failed to specify the virus? What in the world are they doing?
Oh boy.
It is unknown, Doctor. Shall I explain the 1,874 patterns of conjectures in regards to it?
What? No, that's all right. It shouldn't be a problem to make a diagnosis. Roni, let's go back to the office. Time to narrow down our possible candidates.
Understood, Doctor. New symptom observed. Positive antibody reaction.
Well, I don't know how we can make a diagnosis about a disease where
So, we have all the symptoms. It's diagnosis time.
our best candidate is one where you have to know the specific virus that it is. Caused by human herpes virus 8, but apparently this is an unidentified virus. We're still gonna diagnose though.
So it is Kaposi's sarcoma. But why? The period of time until the onset is too short. It's similar to Kaposi's sarcoma. This is something else.
Doctor, we have an urgent contact. Please head immediately to the examination room.
An urgent contact. Well,
Has come to the hospital complaining of abdominal pains.
well, that was quick.
All right, I'm on my way. Abrupt stomach pain. What on earth is going on?
Doctor, these may be related to the tumors discovered before.
We said there were pigment spots though, not tumors.
Great. Roni, you ready?
Yes, Doctor. Commence diagnosis when you are ready.
Apparently things
Reserve an OR just in case.
are getting more complicated.
I bid you good luck.
Well, let's continue then.
Hey, are you all right? What's wrong?
Oh, well, I went to work, but my stomach started hurting all of a sudden.
There's a chance your condition took a turn for the worse. Roni, get ready for examination.
Yes, Doctor. Begin when you are ready.
Alright, let's see what's different now.
My stomach suddenly started hurting, and I feel a little nauseous too.
Well,
I see. So these are the sudden abdominal pains you mentioned earlier. Roni, make a note of it.
Understood, Doctor. New symptom observed. Stomachache.
apparently there's nausea as well.
She's experiencing nausea as well. This is far from being good. Roni, make sure you're getting all this.
Understood, Doctor. New symptom observed. Nausea.
So...
I can't concentrate on my work with this going on. Please, doctor, see if there's anything wrong with me. I've told you everything I've been feeling. Let's see if there's anything else worth mentioning. I guess I have been feeling, a little bloated.
that voice acting.
I see. Her abdomen is bloated then.
Well, this all sounds like...
Understood, Doctor. New symptom observed. Bloating.
We gotta focus in the abdomen.
Lately,
Oh boy.
I haven't been able to, I'm having trouble using the toilet fully. You understand?
Well,
Trouble using the toilet fully? In other words, well, let's just be frank about it. It's nothing to be embarrassed about, right? We're animals. We excrete waste. Right. Well, I won't force you to say it then, but you're unable to produce those things on the toilet, yes?
Yes.
Great. Now we're getting somewhere. Roni, make a note of this.
Understood, Doctor. New symptom observed. Constipation.
well, yes, at least one of them had to say it. And it ends right then. Well, let's take a listen again. I think it doesn't look like anything has changed here. Sounds pretty normal. The stomach might be different though. Oh boy. Yep, that sounds kind of really not the way it should.
Your intestines' bowel sounds are a bit violent. Roni, write this down too.
Understood, Doctor. New symptom observed. aggravated bowel sounds.
And well, apparently that's the only abnormal
Given these
sound.
symptoms, it appears to be a problem with the intestines. Roni, get approval for an X-ray and a CT exam.
I've already sent in the request, Doctor.
Huh, good call. Maybe you should become a diagnostician.
With all due respect, Dr. Cunningham,
Yeah, I was just joking. Let's hurry up, get going.
Well, like before, we didn't really find that much superficially, but
the results of the X-ray and CT examinations are ready for you to look over.
Well, I guess I should look them over.
well, it's time to look at some. Well, whatever's going on here. Looks like there's a telephone inside her, or something that approximates that shape.
The fluid and gas in her intestine have completely separated. It's a NIVU, Roni, an air fluid level.
Understood, Doctor. New symptom observed. Formation of air fluid level.
Seems like an odd shape for that to accommodate into, though, but time to look at some body slices. I'm pretty sure I want to keep an eye on this, but I think one of the things around this area is going to be the problem, if I recall. Oh boy, well, I see the kidneys are kind of a different kind of atrophied, but before I point that out, I feel like there's one more thing that I should be able to find. Or maybe not. Well, let's see.
Atrophying can be seen in the left and right kidneys. Hey, Roni, would you call this a symptom?
Negative, Doctor. The patient has received a kidney transplant.
Ah, that's right. I forgot the new kidneys were transplanted without extracting the diseased ones.
Well, where are the new ones then?
Well, that means this symptom's already been treated.
Correct, Doctor. It does not need to be recorded as a symptom.
I guess you're right. I mean, I was just testing you. Keep up the good work.
I'm sorry, but I do not fully believe you, Doctor.
Hey, could at least play along.
Well, I guess whatever it was we were supposed to find, that wasn't it. Even though it was the most obvious thing. Well, this looks different. This, whatever it is.
Are these shadows in the small intestine tumors? It's hard to make a call. Roni, give me your opinion on this.
Doctor, I do not have any opinions. My answers are based on statistics.
Whatever, just spill it.
I'm currently collating this data with tumor examples in my archives.
Last time I asked a machine for a quick answer.
My calculations show there is an approximately 92% chance that these are tumors.
Whoa! Anyways, yeah, so let's just call them tumors for now then.
We must not do that, Doctor. There remains an 8% probability that they are not tumors.
Yeah, and that pretty much means they're tumors. Well, just record the symptom for now.
Understood, Doctor. New symptom observed. Tumor shadows on small intestine.
Yeah, the chat's been kind of quiet, but you know. This is kind of a.
We've gone through the X-ray and the CT scan. Let's head back to my office and sort it all out.
slow-paced part of the game anyway. And I don't think there's anything else in particular that could come up as a topic right now.
Please narrow down the potential candidates.
Well, I would make another comment about how my dentist visit a few hours ago resulted in far more of half of my face being numbed than I would have expected. Didn't realize that getting an anesthetic shot on the gum would lead to my eye coming numb for like an hour. But apparently it can happen. Also, I am failing to realize which of these are symptoms. Stomach pain, nausea, constipation, and abdominal bloating. Oh boy. Paralytic ileus. Auscultation will confirm a lack of vowel sounds. Well, that is not the case. An image without an air fluid level. Yep, those last two things kind of the opposites of what we have right now, so we'll learn about this thing. Stomach pain, nausea, constipation, abdominal bloating. Auscultation will reveal aggravated vowel sounds. The formation of an air fluid level can be seen, and tumor shadows will appear on a CT scan. Well, we found them. So I guess we got our diagnostic ready.
An intestinal ileus originating from tumors in the small intestine.
Due to the location, there is a high probability that the primary focus will be the ones on the skin.
Damn it. I know, but
Doctor, I would recommend that you examine the other organs as well.
yeah, I agree. Let's go back to the exam room.
Understood. I'll make preparations.
So we've gone through 2 stages of diagnosis yet.
Metastasis spreading from
Yet
the skin
we
tumors to
are,
the small intestine?
At this rate, other organs are also in danger.
God damn. Something isn't right, Roni. Let's hurry.
Even though we found
I'm ready
2
to continue the examination.
sources of aggravation, I guess, we have yet to discover the root of the whole thing. So phase 3 time.
Doctor, how is it? What am I ill with?
I can't say for certain yet. Sorry, but I need to run more tests.
What's with you and roses on your clothes, by the way?
I understand. I have faith in you, Doctor. There's something I need to tell you.
It couldn't be prophetic or anything, could it?
Is it a new symptom?
Well, yes.
Oh boy.
Seriously, this cold season's been really tough recently, hasn't it?
Well, let's see what new symptom there is.
I don't know why, but my chest's been hurting for a while.
That's a good sign.
Chest pains, huh? She looks like she's in a lot of pain.
Obviously.
Roni, could you make a note of this?
Understood, Doctor. New symptom observed. Chest pains.
If this keeps up...
Oh boy.
I'm sorry. Anyway, I won't be able to work if this continues.
You know, we should probably make a note of that.
She seems to be coughing a lot. Could it be her lungs or bronchi? Roni, let's record this too.
Understood, Doctor. New symptom observed. Coughing.
Well, I could tell you all about the joys of bronchi aggravations, but
I won't have to be hospitalized, will I, Doctor? I'd have to rearrange my schedule.
really want to get back to work. Well, now there's chest trouble, so I would imagine I guess you can't auscultate your hand. Now this is gonna sound a bit weird. Well, I don't see anything weird there, but... or there. And this is sounding normal again. I noticed we have an EKG though. Okay. This is what it's supposed to look like. Let's see how it differs. Well, there's a break in the wavelength there.
Huh? What's this? The EKG's display is incomplete. Hey, Roni. The EKG seems to be glitching.
Performing physical repairs is beyond my powers. Please contact customer service.
For the EKG, well,
Customer service, huh? Maybe they can fix how stubborn this thing is, too.
Did you say something, Dr. Cunningham?
Must be your imagination, Roni. Let's begin the diagnosis.
well, let's continue, I should think. Okay, wait a minute. Okay, Okay, the lower part of it starts going up and then goes down. Alright. With that in mind, everything seems pretty normal on this end. I really couldn't tell you what's weird beyond that language, which apparently we're not gonna harp on for any longer than we have to. We don't have any image. Oh boy. Images.
Are you alright? If you're not feeling well, we do have beds ready.
Oh no. It just seems like the chest pains are getting worse.
It's about the chest pains are getting worse.
We
Well,
need to redo all the exams.
Understood, Doctor. I'll make the preparations.
guess it was just a formality. Well, what about talking to her again? Is that also an exam?
When I was coughing just now, I tasted blood.
That's a really good sign.
Tasted blood. This isn't good. Roni, add bloody sputum to the list.
Understood, Doctor. New symptom observed. Bloody sputum.
I can't believe this. I had the kidney transplant. My life was going well. Doctor, it's getting hard to breathe. Could this be related?
Well,
She's suffering from a mild case of dyspnea. Roni, you got that one?
Understood, Doctor. New symptom observed. Dyspnea.
mild case where it's a sudden onset and it gets progressively worse very quickly. Wonder what an aggravated case would be like. Well, apparently we're getting breathing problems now, so I would have expected this to sound different, but apparently it doesn't. And neither does that. Or that. So what about the EKG? Am I gonna see something weird now? Okay, wait. Are those supposed to go that high? Yeah, I guess they are. There's that weird break that we're not going to acknowledge, and there's the rest of this stuff. Alright. Well, I don't know. It looks like I don't really have anything else to go on. There are no images to be analyzed. But
Sorry to keep you waiting when you're so busy. Can I have a little more of your time?
I know. It can't be helped, but please try to be quick about it.
I understand. I'll have an answer as soon as possible.
well, there apparently we haven't found all of the symptoms yet, so I don't know.
I had the kidney transplant, Doctor.
So I don't know, is there anything else that we can do with the visual exam other than the pigment spots? Nope. Not really seeing it. I guess I'm gonna listen again. Maybe the other one? Nope, they still sound normal. So maybe I'm supposed to find something here and I really need to pay attention. I don't know. I just see the same pattern repeating over and over in each of these. Really not seeing it. And if this isn't it, then... Then I would imagine that the only thing left to do is... in the questioning? Well, could ask her about transplant, but...
Kidney transplant.
I would imagine that would be the case. Nope.
Doctor?
So, hang on. We already found dyspnea and the bloody sputum, coughing and chest pain. And all of these were from asking her about it. Is there anything else? Anything visual? Hard to breathe here. That was the dyspnea one. I already saw the pigment spots. And apparently there isn't anything else. Well, I could take a listen again. What about the other one? I really feel like I'm supposed to find something here, but... okay, hang on. God. Well, I'm not really hearing it, but... no abnormalities.
Made a mistake.
Okay. Apparently you're really supposed to find this mystery spot on the chest that makes different sounds. Well,
These respiratory sounds are weak. What about in other areas? As I
yeah,
thought,
we've already heard that.
other areas are normal. They're only weak in the lower left lung.
It's kind of a
Some form
curveball.
of lung abnormality, for sure. Roni, get approval for an X-ray exam. We need it done right away.
Understood, Doctor. The X-ray exam is now available. New symptom observed. Attenuation of respiratory sounds.
Well, we found it. It took a while, but apparently that warranted an exam.
Doctor,
Or an image exam, rather.
images are ready for viewing.
Sounds good. Let's see him.
So let's have a look at the X-ray and pretend we didn't just spend all that time trying to find that. Well, yep, that doesn't really look that great, does it?
White shadow in the lower part of the left lung. It's definitely a sign of fluid accumulating in the thorax. So we know she has a lung abnormality, Roni. Let's narrow down the candidates.
Understood, Doctor. New symptom observed. Pleural effusion.
Not singular effusion, but plural effusion. Well, I guess that's pretty much all we have. Well then, can we get in here and start working on it?
Would you like to narrow down the diagnosis candidates?
Of course. That's why I came here, right?
Well, alright. Acute bronchitis. At least it's not chronic bronchitis. Chest pain, coughing, dyspnea. Bloody sputum. Normal breathing. Well, this counts as abnormal breathing or not. What the hell?
Sheesh.
It might be a good time to save now.
Of course.
And saving this way as well. In case something stupid happens. What about carcinomatous pleuritis? Chest pain, coughing, dyspnea, bloody sputum. Chest pain worsens through coughing. There's respiratory attenuation, and there's evidence of pleural effusion through X-ray. We also need a CT exam to confirm. Oh boy.
All her symptoms apply to it.
Shadows in the lungs.
We'll need a CT scan to confirm the diagnosis, though. Roni, how's our patient doing?
She's not doing well, Doctor. Please return to the examination room immediately.
That's what I thought. All right, let's go check on her.
Oh boy. Could something worse have happened in the short time we were away? Well, all I can say is that must have been fun to record.
My chest. It really hurts bad now, Doctor.
Her condition's worsened even further. We can't continue on with the diagnosis. Roni, request a room immediately. She needs to be hospitalized and her symptoms need to be treated.
Doctor? No. I can't just let the symptoms be treated. Can you please continue examining me?
Why would you say that?
Huh? Do you know how much of a risk you're in right now?
I finally thought that I could live. I had a new kidney. I recovered from the operation. I could finally live a life on my own. So please, Doctor, please find out what's wrong with me. Please cure me.
Roni, cancel that hospitalization order. Let's finish the diagnosis.
With all due respect, Dr. Cunningham,
What? You always rant about how I need approval from the patient when it comes to performing exams, but you won't listen to the patient when it comes to hospitalization and diagnosis? When things are inconvenient, we should push all the responsibility onto the patient? Spend all day worrying about how to avoid a lawsuit? To hell with that!
understood.
Oh boy.
Even I find incongruities with the protocol that I have been designed to conform to. I think I shall add, to hell with that, into my computer registry.
Alright.
My thoughts exactly. Right.
Is that under
So it's
H key
X-ray time
or...
again. And order a CT scan as well.
Understood, Doctor. The CT examination is now available.
Well, because of that bolstering speech, we now have a CT exam.
Put them on the display. I want to see what's going on.
So let's go find some tumors. Oh boy. If I had to guess, the other tumor shadows are gonna be in the lungs.
We'll have to be careful here.
Yeah, I can't really have 2 hearts left.
Tumor shadows. Roni, make a note.
Understood, Doctor. New symptom observed. Tumor shadows on lungs.
Alright, we have the last step of the way.
Put them on the
Doctor, the patient's condition is in a critical state. Please finish gathering the symptoms and make a prompt diagnosis.
Yeah, I can't overlook anything. I need to check the images carefully.
But he already did.
Yeah.
Do we need to find something else? I mean, we found a tumor shadow. I thought that was what we were after. I guess that wasn't enough. Multiple tumor shadows. Not really seeing it, I gotta say. Well, there are only 5 images. I would have thought that would have sufficed, but... Oh, never mind. There was apparently a new X-ray. Which I totally failed to acknowledge. And there's that strange
Calm down. Figure out what's really
Bruce again.
Huh? What the hell is this? Hey, Roni. This shadowing.
I anticipate this is a new symptom, as it was not confirmed by the previous X-ray.
New symptom? Don't be ridiculous. I've never heard of anything like this suddenly popping up inside someone. Roni, collate the data and check what it is.
Yes, Doctor. One moment, please. There is no matching data. It is an unconfirmed symptom.
Damn it. What's going on?
There is a less than 1% probability of ascertaining what it is from the data at hand. I recommend that you remember the shadowing for later and continue with the diagnosis.
Yeah, you're right. We can't spend any more time on this. Roni, let's continue with the diagnosis.
Alright, we have the mystery...
I think I have enough to make a diagnosis. Let's get back to the office.
The mystery shadow that makes bad things happen.
Is that shadowing?
And we got the tumor, but all we need to finish the diagnosis is the tumor.
We should have all the symptoms now. Roni, I'm gonna make a call on the diagnosis.
Understood, Doctor. Displaying the diagnosis candidates.
Well, this is the last one we needed for this, so...
There's no mistake that it's carcinomatous pleuritis. But I'm not convinced. Skin to the small intestine. Small intestine to the lungs? How can a focus that devours the human body at such a rate exist?
Doctor,
Oh, sorry. What is it?
no further progress can be expected at this point. The diagnosis will be completed temporarily. I will leave the cause of the disease as unknown and call attention to this case.
Yeah, you've got no other choice. I'm stumped. What am I supposed to tell her?
Well done, Dr. Cunningham. Ending the diagnosis.
Well, there we go. Mystery affliction.
Are you alright?
Also, you have tumors, there's
Something
that.
Please, you can say it. What's wrong with me?
I'm sorry, but I can't say anything for sure yet. Please be patient. I want to keep you hospitalized a bit.
That's fine, Doctor. I'll put myself in your hands.
I'm sorry. I promise I'll do everything in my power. Hey, Roni.
Do you need my assistance, Dr. Cunningham?
Another little trick of yours, huh? Sounds useful.
I can utilize this facility's entire installation network.
Huh. All right. So, what do you think about that patient?
I found no reasonable matches within the current literature. I suspect it is an unidentified condition.
Well, for once, I agree with you. It mirrors Kaposi's sarcoma, but it spreads much faster.
I estimate the entire lung will be affected within 20 days.
We don't have time to sit and think. We need to treat the skin, lungs, and small intestine all at once.
An operation like this would yield a 10% success rate.
There's no other options, though. I'm stumped.
Should I request a hospice transfer and notify her family?
The earth was blue, but there was no God. We did all we could. Now, we just have to hope for the best.
One thing I've learned over the years, never give up.
I'll be assisting. A specialist's coming in for it.
That's it! Roni, you said you have access to the full facility, right?
I did, Doctor.
All right. I want you to look up OLCVR data. The records, footage, surgeon name, contact info, everything. I promised I'd do everything in my power. Well, I guess I gotta follow through with that.
Scout, and the Coker's forceps too. Hurry.
Oh boy.
Isn't the boy just superb? Now are you glad he's here?
Yeah, thanks to you. I'm in your debt, I guess.
You threaten me so you can use him, and then you thank me.
Hey, no threats. I just asked you to lend them to me.
Of course not. Still, I have to say, it takes guts asking for such a big favor to save your patient. Well, son, I guess you and I are square now.
To save a patient, huh? That's nothing noble like that.
Well, that certainly took long enough, but... Well, apparently more stuff is gonna happen with that mysterious condition now that Spike, aka Dr. House, aka Gabe, managed to get that sorted out. So, oh boy. Only 2 things left in this time period. And one of them is a surgery operation. I have the feeling I know who it's going to be on. It's back to Mr. 250-year sentence.
That was a fine operation, Doctor. Thank you.
Life.
Yo, kid. Came by to see what you're up to. Man, I didn't think you'd be living in a refrigerator.
Temperature's kept at 0 Celsius to reduce bacteria. And so I can't kill anyone.
Bacteria cultivation, huh? Pseudomonas, Vibrio, Micrococcus? You know, plenty of bacteria can be grown at this low temperature.
And you are?
Gabriel Cunningham. I'm in charge of the guy you worked on. I want to consult with you about something.
Consult with me.
We've got a patient with tumors similar to Kaposi's sarcoma. Skin, lungs, small intestine, they must be excised at once. How about it? You think it can be done?
There's not enough information to make a conclusion. But depending on the patient, I won't rule it out entirely.
Is that so? All right, it's decided. Let's go.
What are you talking about?
The operation. You'll be performing it on that patient.
Me?
What's wrong? That's why I came out to see you.
Please check the arterial forceps. Are all the medicines ready?
We're running
So here we are.
transfusion supply.
I'm putting extra trays here. Where's the anesthesiologist? Oh, come on in. You're late.
You are...
Maria Torres. I'll be assisting you this time. You've heard the details, right? Read the charts, too.
all right?
I have seen you before. Have we met?
I hear this is a tough condition to deal with.
Yeah, you're right. Let's start the operation then.
I guess he had time to assimilate the charts through osmosis in that time. Well, he got to take out the tumors in that person now. Skin, small intestine and lungs simultaneously.
But
Caused by the mystery shadow condition.
Well, it's odd. Infections like this aren't all that rare. Even so, we can't pinpoint exactly what's causing them.
So we don't know what's causing this.
have you done a blood analysis?
Please. Of course we did. Do you think we're stupid? Nothing showed up on the CRP, antibody titer, or WBC count.
Well, didn't even get to look at the blood analysis
Other
before.
tests came up with nothing too. We're stumped.
That is indeed odd.
Well, hopefully this will be an uneventful op. Let's begin.
Well, I mean, this is only the second one, I'm pretty sure. So it's no longer about just draining blood from the
Well
hearts.
then, let's begin the operation.
So only we just need to
That
burn
is
off
Dr. Cunningham. Says it's like Kaposi's sarcoma.
these shiny
Who
tumors.
knows what it actually is, though?
No one knows what this is, yes.
Foci show discoloration, like malignant melanoma. Let's begin by treating the skin. Prepare the laser.
Yep, tiny tumors, so laser time.
First affected area removed. Incinerating the...
They're all burned off. Put out.
And the magic gel shows
There
them
aren't
up.
any more here. Let's check the intestine.
No, we're not done yet.
Aren't we, though?
There may be tumors under the skin here as well. I want to check the area with the ultrasound.
Well, those are big ones.
Cytoplasm is going on. I'll use the... Now I'll excise it with a scalpel before it leaks. Tumor excision.
Well, they work the same way as before, yes. I know how to do this game. I've only been doing this for like 3 games before this one.
Looks like all the skin tumors are done. Let's keep going.
Understood. Making an incision. Area disinfected.
Alright.
Making an incision.
Let's chop open the waste and see what's in the intestine. Oh boy.
Now, if it's the same as the skin, tumors should be here too.
Tumors and
First,
inflammations.
we need to inject blue medicine into the inflammation. Inflammation has subsided. Let's treat the rest too.
So we deal with this and we find the tumors presumably.
There are probably more inflammations around.
And we use the magnification tool as well.
In my view, prepare the magnification tool.
So you know this is all familiar territory really. No tumors here
Tumor
though.
presence
Ah, there it
confirmed.
is.
Treating it and inflammations.
So let's just get a move on.
That's the first one. Keep going.
Inflammations are all over the field of operation.
Okay, you got a tumor down there and inflammations next to it. It's all part of the plan. Alright. Don't see. Oh, there's a tumor right there, but might as well deal with the red spots first. There it is.
Third tumor has been extracted. Now for the inflammations.
Alright. And more tumors are happening even as we don't look, I guess. Well, there's inflammation there, but I didn't see any tumors in that
The
area.
intestine has been treated. We're doing well.
Ah, I guess there wasn't.
Don't relax yet. We still need to treat the lungs.
I know. You're pretty blunt, aren't you?
Get ready to shift the focus of the operation.
Alright.
I found
Well, that
some
was
tumors
quick.
in the lungs. Prepare the laser.
That small tumor's taken care of, but there's more. Easy peasy. Oh boy.
There's tumors here too, right? Find them with the.
I found a tumor.
Oh boy.
It's not a tumor. Is this mucus?
Well, you would usually find mucus if the bronchi were inflamed.
This doesn't change our treatment. Let's continue. Using the drainage.
Apparently you don't have to suture that either. Just use the magical... Oh, here we go. Hello. Gel to
Use the ultrasound.
seal that up instantly and without repercussions. Here we go.
Beginning extraction.
Tumor found.
That should stop the mucus.
The mucus which we apparently need to find more of as we are not up yet. Ah, there we go.
Tumor markers aren't decreasing. Must be the mucus.
And there are the shadows.
What is this? Some kind of bruise?
That proves.
Hey!
So, boy.
You alright? Hell, is that mucus
Oh boy.
moving?
Moving magical tumors. And the mystery bruise. Which apparently Mr. Red Eye Surgeon here recognizes from somewhere. Oh, come on. There was something right there, wasn't there? Ah, 2 tumors. Two tumors, which thankfully are still pretty simple to take care of. Right, and I completely failed to see those 2 shadows over there. There's still something else moving around. Looks like it's just mucus this time, though. I hear something. I guess the stuff that moves is mucus, and the stuff that doesn't are the actual tumors, maybe. Who knows? I don't. Doesn't look like there's anything more though than those 2 things. Alright, tumor surfaced, tumor removed.
Is it over?
Yes, I'll start treating the mucus and remaining wounds.
Alright, there we go. Bruce has been placated.
Alright, let's close this patient up and finish this off.
So all that's left now is close up.
You know how to treat those things.
Well, it wasn't really that different. You just need to be mindful of the fact that they're moving.
I don't know. Black bruise. I've seen it somewhere.
Where would you see something that weird before?
Well,
Let's finish the operation. Get the antibiotic gel ready.
mysterious disease, and he's the only one who knows about it.
Ending operation.
And
Well, you know,
he's in prison for a 250-year sentence.
you're a big help. Let me at least thank you.
This seems like Maria's okay with him being around. So let's see. Got all the bonuses, but I have a feeling that I didn't think I was gonna get an S rank. I thought that was a little sloppy,
That was
but
quite the show. Looks like we can trust you.
I'm just doing what I was brought here to do.
Sheesh, aren't you fun to be around? Take a compliment.
it turned out pretty well. Also, I think we're about to learn some plot here, backstory.
Oh, how'd it go?
All the tumors have been extracted. It's a unique condition, so keep her fully monitored.
You're just leaving now? Well, that's pretty irresponsible.
I'm a prisoner. I can't do anything else from here.
Well, not exactly. You're responsible for that patient until she leaves.
I heard that you'll be in custody here for a while. Let me tell you that I'm firmly against this decision.
The new room's over there. It's barred, but it's no icebox.
Oh boy.
We'll be counting
Apparently,
on you to help us save lives here, kid.
apparently he'll be staying at the hospital for a while. And it looks like, oh, never mind. There's still more cutscene left.
Satisfied?
Are you kidding? I need to see how he does before I decide. Besides, his entourage is a pain in the ass, too.
What do you mean by that?
Don't treat me like an idiot, G-Man. I see a lot of new faces around here. Curious faces.
Doctor, we're...
Whoa, whoa. I try not to get involved in other people's jobs. Let's just agree not to interfere with each other. Got it?
Thanks for your cooperation.